Hello. Look at this question asked here for 5 marks. They have asked about community acquired pneumonia. Okay, so about pneumonia they are asking antibacterial therapy. Okay, only the antibiotics kind of thing they are asking for what pneumonia? Community acquired pneumonia, CAP. Okay, what are they asking? Antibacterial therapy for community acquired pneumonia for 5 marks they are asking. Okay, so first of all let's get started. What is pneumonia, guys? So pneumonia is the infection of lungs, of lung parenchyma. It's the lung parenchyma, the alveoli which are infected. Okay. So here it is an infection and it is of the alveoli. So the alveoli are your last part, right, which actually do the exchange of gases, etc. So that is where the problem is. And what is it? It's an infection. These two words should come out. So will you be able to write this in the exam? Infection of the lung parenchyma, especially the alveoli. Okay. In that, how many types you have? You have community acquired pneumonia, that is the CAP that we are talking about, right? CAP that they have asked in the exam. Then you have the hospital acquired pneumonia, okay, that we will say HAP, okay. Then you have aspirational pneumonia, etc. Okay. So basically, what have they asked here in the exam? Community acquired pneumonia. See, community acquired pneumonia means you should understand that it is common, very common. You just travel by metro or you travel by a crowded bus, then you will get because of droplet infection, right? So community acquired pneumonia, how will you treat? Antibiotic therapy they are asking. See, what are the other pneumonias? Hospital acquired pneumonia. So in this, what happens? The patient will be perfectly fine when they come to the hospital, and after staying there a few days, then they will contract this pneumonia. Here, the main thing is that there is a chance of drug resistance in the drug resistant bacteria. That is what you have to understand about hospital acquired pneumonia. And the other things are aspirational pneumonia, etc., which we are not they are not asking about in this exam. In this, what they are asking, community acquired pneumonia. Okay. Now, what are the organisms which cause community acquired pneumonia? So let's focus here. This is from Davidson textbook. So here it can be by bacteria or by virus. Okay, it can be bacteria or virus. And if it is by bacteria, the first thing they have put is Streptococcus pneumoniae. So pneumonia, you understood, right? Streptococcus pneumonia. Then you write all the other pneumonia. Mycoplasma pneumoniae, Legionella pneumophila, Chlamydia pneumoniae. Then so many pneumonia, Klebsiella pneumoniae. Nice, no? Apart from that, what and all are there? Haemophilus influenzae. This is actually a bacteria, interestingly, right? Influenza is a virus, but para-influenza is a virus. But Haemophilus influenzae is a bacteria. Then you have Staphylococcus aureus. Wherever Streptococcus goes, Staphylococcus goes there also, looks like. Okay. Chlamydia. And we will leave the others. Q fever. Okay. Okay. What is that? Coxiella burnetii. Okay. So we have learned all the names of the bacteria which causes it. That they didn't ask, but they asked only the antibacterial therapy. Okay. So let's quickly get to the exact answer here. Community acquired pneumonia, how will you treat? Okay. You have diagnosed and investigations you did, you know the clinical features, investigations you did, you know the differential diagnosis, but finally you have decided it's a community acquired pneumonia. What will you do? So you will give oxygen to that person, fluid balance, all electrolytes, etc. Then because especially if it's viral, I think you will talk a lot about fluid balance, right? Then antibiotic therapy. Antibiotic therapy, even if it is a viral, sometimes they add if it is causing a secondary infection, right? So we will talk about antibiotic therapy. This is what they've asked in the exam, antibiotic treatment, and then you will treat for pleural pain and all if they have, and then physiotherapy to get all that sputum out, etc. Okay, but here what are they asking in the exam, guys? Antibiotic therapy they are focusing on just for 5 marks. Can you imagine? So much you have to write for this. Okay, take a deep breath. Let's look at the antibiotic treatment for community acquired pneumonia. Okay, so in this, how they have divided, let me tell you, there is low severity, moderate severity, and severe community acquired pneumonia. These are the 3 headings you have to write, and under that you will write the antibiotic treatment. Okay, so if it is low severity, what will you give? Low severity means how will you decide it is low severity? There is a curb, hospital curb 65 score. If it is, the score is coming from, if it is 0 to 1, that means in home treatment itself you can treat this guy. Just give him amoxicillin. How much will you give amoxicillin? We are considering it as a normal adult. 500 mg 3 times orally. This you already know. Standard what you write in your prescriptions, right? Then they didn't say the number of days of treatment. Okay. So how many days of treatment do you want to give? 5 days? Okay, you can decide that. They did not mention the number of days of treatment. And if the person can't take orally only, they're saying IV. Okay. Now, if the person is allergic to penicillin, then they're talking about doxycycline. Guys, are you with us? So, if the person is allergic to penicillin, okay, that is amoxicillin, you will give doxycycline. So, what we give actually is 100 mg twice daily you can give. Okay. For 3 days. So that is what I have written here in my notes. However, you can decide based on your guidelines. Okay, and uh, so basically, what the textbook says, we have written here. Remember that doxycycline 100 mg comes. Okay, so you can give twice a day initially and then once a day. That's what they are telling. Okay, then clarithromycin also they are talking about. Where does clarithromycin come in the classification? See, clarithromycin is macrolide antibiotic. Okay, doxycycline is tetracycline. Amoxicillin is penicillin. Okay, so clarithromycin is what? Macrolide antibiotic. We will show you the classification. Just hold on. Now let us look at the moderate severity cap. Okay, how will you treat moderate severity cap? So that curb score is 2. Okay, so again they are telling you will give amoxicillin, benzyl penicillin. Very carefully should be while giving this. Okay, they are talking about benzyl penicillin, that is IV. Okay, then clarithromycin. Same thing only, you can look at the doses, etc. If the patient is allergic to penicillin, then doxycycline, levofloxacin. Levofloxacin comes under which classification, guys? Fluoroquinolones. Okay, very good, very good. So what got added on this screen? Benzyl penicillin and levofloxacin got added here to the already existing list. Now let's go to severe cap. Severe cap, they are adding to the same things. They've added cefuroxime and ceftriaxone. Cefuroxime IV, ceftriaxone IV. Okay, everything IV only they're telling here. Okay, now this is what you have to understand. Everything has become IV here. Everything here is IV. Okay, so the cefuroxime is what? Is second generation cephalosporin. Ceftriaxone is third generation cephalosporin. Okay, we will see all that, but now just look at one more slide is there here. If Legionella is suspected, so in the bacteria list you saw the bacteria, right? If they are saying if it's Legionella, okay, if it is Legionella, then you should add levofloxacin 500 mg. Okay, levofloxacin 500 mg. Okay, so they are again talking about IV. Okay, so did you get all this? Very good, guys. So will you be able to write the antibiotic therapy? So what will you say? If curb score is 0 to 1, right, then it is low severity cap. Then you will give amoxicillin. If the person is allergic, doxycycline. And what did they say? Clarithromycin. Then if it is 2, then it is moderate severity cap. Then you will add to all this, you will add, what did you add? Benzyl penicillin. And then they added levofloxacin, I think. Then 3 to 4 curb scores, curb 65. Then they are saying it is severe. There they have added, what did they add? The cefuroxime and ceftriaxone, right? And then if it is Legionella, they are talking about levofloxacin. Okay. One more thing is that severe cap, though, guys, it is co-amoxiclav. It's not just amoxicillin. Amoxiclav it is, okay, with clavulanic acid, okay, so that it can work better. And everything is IV in severe cap, okay. Now let us go to that. What is that curb? We'll look at that first, okay. CURB, okay. Curb 65 means confusion, urea, respiratory rate, blood pressure. And there's one more, age, okay. Age is 65. That is only set 65, okay. So if there is confusion, 1 point. If there is urea greater than 7 millimole per liter, then 1 point. If respiratory rate is greater than 30 per minute, then 1. Then blood pressure is less actually, then it is 1 point. If age is greater than 65, 1 point. So if this is how you will add. Okay, great. So did you understand? Now let us look at where all these antibiotics sit in the classification. So here you have amoxicillin under penicillins. Where is your amoxicillin? Here. Okay. So it is amoxicillin is sitting here under penicillin, and then the other one that you saw was benzyl penicillin to add if it is moderate severity. Benzyl penicillin is sitting here. Okay. Then clavulanic acid that you will add if it is severe, that comes under beta lactamase inhibitors. Amoxiclav they said, right? That one. Okay. So that clavulanic acid gets added with amoxicillin if it is severe. Okay, this you understood. So if the person is allergic to penicillin, what did they say? You have to give tetracycline, that is doxycycline, then 100 mg per day. Okay, so you got it. Doxycycline you understood. Then Clarithromycin, let's find that. That is a macrolide antibiotic. So here you have macrolide antibiotic. Under that we should be having clarithromycin. Very good. Okay. That one, how much they were telling? 250 mg or 500 mg they are saying. Okay. Then what else? We have to find that levofloxacin, right? Levofloxacin is here fluoroquinolones, okay, under quinolone antimicrobials, okay, fluoroquinolone. And what else do we have to locate? Because if it is severe, they wanted to add cephalosporins, so that is there here, you can see. Cephalosporins. Under second generation, you have cefuroxime, and under third generation, you have ceftriaxone, okay. Everything IV, okay. This is parenteral, you can see, IV, okay. You got it right? So if they ask you what is the recommended antibacterial therapy for community acquired pneumonia, you will be able to write, okay.